Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Mohini Dasari. She's a general surgeon. Her Kevin MD article is titled The Untold Struggles of a Surgical Fellow. Mohini, welcome to the show.
Thank you. Thanks for having me.
So we'll get into your article in a little bit. First off, briefly share your story and journey.
Sure. So I'm originally from the East Coast. I grew up in New England. I went to school in India for a couple of years and then did med school in Pittsburgh, came out to Seattle for residency, which is where I did a little bit of fellowship as described in my article. And I just started a new job out here.
Perfect. And what do you do right now?
I just started as an acute care surgeon at a community hospital. So that's basically taking all the emergent, urgent cases that come either from the ER or from inpatients and taking care of them.
All right. So your Kevin MD article, like you said, talks a little bit about this journey. So let's just jump right into it. The untold struggles of a surgical fellow. Now, tell us, how did your article come together, and share your story?
Yeah, so it's been quite the year. I think probably the most eventful year of my life, just a lot of big life changes. I graduated general surgery residency in June of 2022. And about midway through my residency, our residency is 5 years long, I decided I wanted to do transplant. It was my favorite subspecialty that I had rotated on. And I matched here for fellowship. And so going into fellowship, I had a 1-year-old, like a little bit over 1-year-old. And the fellowship, I knew it was going to be grueling and hard and intense. That's something that a lot of people know about transplant. But I think what I just couldn't have predicted was sort of how family and life events, including my husband developing a pretty serious back injury that required multiple surgeries, along with just the training environment that I found myself in and how it affected my own mental health and well-being as a learner, how that all kind of coalesced to become essentially just a lot of stress for me to handle.
So, for those who aren't familiar with what a transplant fellowship is like, just give us an idea. When you say that the training is grueling and intense, just give us a picture of what exactly that means.
Sure. I think people might be more familiar with like what surgical residency is like just from, people working in the hospital with surgeons. And I don't mean this in a way to sound, light about residency at all, but I really felt like residency was a lot easier compared to fellowship. And, that's saying a lot because I think surgery residency is definitely not easy, but, my each program is different, but my fellowship, I was off 2 weekends a month and otherwise I was on 24/7. So whether that was for inpatient questions from, residents who are helping cover the service, outpatient phone calls from attendings who want certain things done, having to go in for cases, it was 24/7, 12 days in a row with every other weekend off. And so I think time is one thing, but I think the other thing is just that the surgeries are long, the patients are sick, there's a lot going on, and there's a lot being sort of asked of you as a fellow. So not only doing cases, obviously, and learning these complex operations, but taking care and taking charge of the whole inpatient service, which can be, upwards of 20, 30 patients, overseeing the residents learning, kind of, having to interface with all the attendings and all their specific needs. So it was just a lot.
So, I don't want to understate this. So, you had already completed a general surgery residency, and you're saying that life as a transplant surgery fellow was something even beyond what you experience in general surgery residency. Is that correct?
For sure. I think it was a lot harder. And I think, I've obviously reflected a lot on this and how much did, my other circumstances, like having a daughter and having, a husband who's going through some medical stuff contribute. But I think I just was never at home. And I felt like also in residency, I had relationships with attendings and, I was there for longer and I felt like there were other people. So it was easier to sort of have someone cover for you sometimes if you had something to do or you had to take care of yourself. And I think because transplant is just so demanding and difficult and there was only me and another fellow, it really, your absence really can't take place.
And did these circumstances, did they crop up, or were you surprised by them during perhaps the interview or vetting process?
I one of my good friends was a fellow actually while I was interviewing and applying and so I knew, that I was going to be busy. I think only when you are faced with like unexpected hardships in life is when you realize how much you need like understanding and support from your work environment. And I think this is beyond medicine. And so I think I obviously couldn't have predicted that my husband was going to have a herniated disc and need 3 surgeries. I couldn't have predicted that not seeing my daughter for 12 days in a row was going to have such a significant impact on my mental health. And so, like, when those things started coming up, and I found that I didn't have the space or ability to advocate for myself because, quite frankly, the system was too stretched thin, that's when I really started to crumble. And I don't think I had the ability to see that before I was in it.
So tell us what kind of steps you took before leaving that fellowship. So, where
Yeah.
did you try to turn to for support as these other life circumstances were happening around you?
Yeah. So I've been pretty transparent about this, but in coming back to my chief year of residency after I had my daughter, I had pretty severe postpartum depression and started seeing a therapist and had stayed with that therapist, even to this day. So I had therapy once a week, which was
Hmm.
an hour once a week where I could just sort of, vent and talk and have someone whose job it was to sort of help me kind of figure out what I was dealing with. And it always sort of felt like damage control. I think I was just trying to cope and survive. And so that was one of my outlets. I talked to friends and attendings from residency too, but I think a lot of the difficulty was that I didn't really feel like there was space for me to talk about my personal struggles within my program, because part of it was that I didn't really feel like I had a person that I could turn to in that way, in that capacity. And part of it was I think everybody else was so stressed and overworked that nobody had the bandwidth to deal with me and my issues, which I understand. But that's when leaving started becoming more of a real possibility because I didn't see any other way to make things work.
Did you bring these issues up with your fellowship program in the hospital at all?
To lesser degrees, I let them know that I was, having childcare issues because my husband literally couldn't lift my daughter because of his back. And, she's like 20, 30 pounds. And the response was, I think, always pretty like matter of fact and like, okay, like do what you have to do. But it wasn't, I guess I didn't really feel like I had a community of someone to check in on me and just say, like, how are you doing? Are you okay? And maybe that's the sensitive and emotional part of me that wanted that and kind of craved that, but I had that in residency. And so I think that transition,
Mhm.
especially coming from a community and an educational environment where you have attendings checking in on you and caring about you as a person, and then feeling like you have to go into this environment where you have to hide that hide side of yourself, that was a challenge for me.
Because I
uh,
would think that the fellowship program would be more empathetic to your situation because with you leaving a program, that's going to make things difficult for them as well.
yeah, I mean, I think the leaving, I didn't really talk about it openly with people until I felt like I had no other options left, but I tried to let people know what was going on at home as much as I could. But I think the fact that people would never ask or check in, or when I said I needed to go do X, Y, or Z, instead of saying like, oh, of course, why don't you go take care of your husband or your daughter? It was always like, well, when are you going to be back? Or, well,
Mhm.
you can't miss this case. Well, this is happening. So it just wasn't the right environment, for me to actually advocate for myself, because the message was always like, well, this is the priority.
So it sounded like there was implicit or even explicit in your case pressure to focus on the work at the expense of everything else.
Yeah, I think so. And I think that extended not just to me, but I saw that affecting all of the surgeons. So, in some ways I don't blame the attendings. I think it's a systems issue. But at the same time, I feel very strongly that, like, as physicians, we need to look out for each other. And
Sure.
I didn't feel like anybody had the capacity to do that.
Now, talking to your fellow surgeons and fellows, is this something that's particular to this specific program, or would you say that's systemic nationwide?
It's tough because I only have my experience here. I think again, I don't think it's just this program, and I don't even think it's just this specialty. I think there are surgical specialties like
Mhm.
cardiothoracic, transplant, vascular, certain specialties that are just known for being more demanding, more intense. But I think this is something that I've seen in and heard about from other locations. And I think, again, it's often when systems are stretched so thin, they have so many cases to do and not enough people to do all the patient care that needs to be done. I think that's kind of a perfect breeding ground for stuff like this.
Is there anything that you would have liked to see here and done? You alluded to this earlier, but what specifically would you have liked to see?
I think honestly, just when I was bringing up what was going on at home, and when there were cases that someone else could have helped cover so that I could have gone and tended to some things at home, I think just some grace and understanding was all I really wanted. But instead, there was a lot of, unfortunately, sort of punitive comments that were made, and sort of like, well, we expect you to do X, Y, and Z. And it just felt very much like they were turning a blind eye almost to what I was alluding to that I was dealing with at home. And at the end of the day, I just kind of decided this is too strict for me. Like, I need more understanding. And so I don't know how to implement that on like a systematic scale, but I really think like seeing trainees as individuals who have lives outside of the hospital is important. I mean, I had one attending tell me, for the next 2 years, you're just going to have to forget your family, forget your friends, forget everything, and just learn transplant. Like, that was something that someone said to me as a mother with a child. Like, I don't think that's right. And I don't think that you have to do that in order to be a good transplant surgeon. I don't think so at all. Um,
So when you told the program that you were going to leave, what was their reaction?
It was pretty muted, honestly. I had one person tell me that they kind of expected that I was thinking about things, which surprised me because I had never told that individual anything about my thoughts about leaving. So I'm not sure if it was a rumor that came up or something, but that surprised me. And then another person just kind of said, okay, I'm not going to ask you more questions. I'm sure this was hard enough for you. But I almost wanted them to ask me, like, why are you leaving? What's wrong? Like, can we do anything to make you stay? But nothing like that happened. And that kind of almost just validated me more in a way that it was the right decision. It kind of feels like you're breaking up in a relationship almost. And like, if the other person doesn't want to try to look for a way to make things work, then maybe it's just best to part ways. And that's kind of how I felt.
Now, on Kevin MD and on this podcast, and I'm sure a lot of other physician groups, we always try to say that physicians are more than our degrees. We are mothers and fathers, and we have lives outside of medicine. But it sounds like there are many areas still within medicine who still cling to that antiquated way of thinking where medicine is your life, and even at the expense of your family. Is that right?
I think so. I was just having dinner with some colleagues last night, actually, and talking about how I think in surgery, especially, there's still so much of that, like, you kind of get like a badge of honor for being tough and like, oh, I stayed up operating 36 hours in a row. I'm so amazing. I think that's slowly starting to fade away, but that culture is still there. And I think as long as that's still valued as like a badge of honor, I think we're not going to be trending in the right direction.
What do you think is going to take to change that culture?
I think a lot of it is just like having newer generations of people come in. I've met medical students more recently, and they're even more like attuned to these issues of work-life balance and wellness than I was when I was a medical student. So I think it's just the natural course of time will help change things. But I think also this is why I feel strongly about sharing my story, because I think people who leave, I was listening to another one of your podcasts of a woman surgeon who left academia for community practice. And I think the more people who share these stories about the realities of why we leave, I think that's going to be important. Transparency.
So tell me
Um,
some of the reaction that you receive after sharing this story.
it was very overwhelmingly positive and honestly validating, because this whole experience was pretty isolating, and I felt like a failure for giving up on something. I think a lot of us who go into medicine are very driven, type A, we don't like to give up. And so putting this all out there was very vulnerable. And I was shocked by how many people reached out and just said that they really could resonate with parts of my writing. And, that's my reason for sharing, is because I don't want people to feel alone.
Now, if you were to do this journey all over again, is there anything that you would have done differently?
That's a really good question. In some ways, I think I still would have applied to transplant because I liked it. I can't say I wouldn't have done that, but I struggled a lot during those 7 months that I was a fellow, and I did a lot of self-gaslighting, telling myself that I should have just been stronger and put up with it. And I think I would have advocated for myself sooner and probably left sooner.
Now, you have that perspective of a general surgeon and 7 months of a transplant fellow. Now, speaking from that perspective, there are a lot of other people who I'm sure are in similar situations to where you were. Tell us what kind of advice you have for them in those specific situations.
Yeah, I think absolutely putting your your emotional well-being and mental well-being first is something that I can't understate. I feel like everybody in medicine should have a therapist, honestly. And I think that if you are feeling overstretched, to like pay attention to that. And it's just not going to get better. It's going to get worse if you keep shoving that down and, ignoring your needs, not just for sleep and food, but for time with family and whatever it is that rejuvenates you. And so I think not denying yourself what you need is super important. And if your training environment can't give it to you and you've tried to advocate the best you can, then considering other options, because ultimately it's your life.
Now, how difficult is it for surgeons to do that? Because, like you said, there's this mentality and culture that's already ingrained, and it's very difficult to do what you just said. Now,
Yeah.
how can these young surgeons take care of themselves first within that surgical education environment?
I think residency programs are getting a lot better at sort of, cracking down not only on work hours, but like trying to help residents get to therapy appointments and things like that. So I want to sort of acknowledge that there's positive steps in the right direction, but I think residents also, and I felt this way too. You feel bad taking an hour out of the day for yourself or whatever, but leaning into that, senior residents supporting junior residents, kind of just systematically trying to help people get what they need, whether it's getting to an appointment, getting home early to see a kid because they haven't seen a kid in 3 nights. I think looking out for each other and getting help when you feel like you're not doing well are two of the tips I have.
We're talking to Mohini Dasari. She's a general surgeon. Her Kevin MD article is titled The Untold Struggles of a Surgical Fellow. Tell us some of your take home messages that you want to leave with the Kevin MD audience.
I would say that, finishing a program or finishing any sort of pursuit in medicine, don't try to prove anything to anyone. Just make sure you are happy and you're feeling fulfilled in your life. Because if you're not, then, it's time to reevaluate sort of where you are in your priorities. And making big changes is scary, but having done it and being on the other side of it, it's so worth it. And I'm in such a better place than I was. And so I just want to tell anybody who's listening that even if it's scary, it can be probably one of the best things you can do for yourself. And I'm happy to talk to anybody offline about, going through things like this.
Well, thank you so much for sharing your story, time, and insight. And thanks again for coming on the show.
Yeah. Thank you, Kevin, for having me.